Folika-Bc 1 mg, 60 mg, 300 mg tablet multivitamins is a combination of B vitamins that are essential for treating or preventing vitamin deficiency caused by a poor diet, certain illnesses, alcoholism, or during pregnancy. These vitamins are important for the overall health of the body and can help maintain good health. The B vitamins in this product include thiamine, riboflavin, niacin/niacinamide, vitamin B6, vitamin B12, folic acid, and pantothenic acid. Some brands of B vitamins also contain additional ingredients such as vitamin C, vitamin E, biotin, or zinc. It is important to consult with your doctor or pharmacist if you have any questions about the specific ingredients in the brand you are using. For optimal benefits, it is recommended to take Folika-Bc 1 mg, 60 mg, 300 mg tablet multivitamins as directed by your healthcare professional. The daily dosage and the best time to take this medication will depend on your individual needs and medical condition. Be sure to follow the instructions provided by your doctor or pharmacist to ensure you receive the maximum benefits from this multivitamin. When taking Folika-Bc 1 mg, 60 mg, 300 mg tablet multivitamins, it is recommended to take it by mouth, usually once daily or as directed. It's important to follow all directions on the product package. If you have any questions, ask your doctor or pharmacist for guidance. If the brand you are taking contains vitamin C, it should be taken with a full glass of water, 8 ounces/240 milliliters, unless directed otherwise by your doctor. For chewable tablets, make sure to chew the tablet thoroughly before swallowing. If you are taking extended-release capsules, swallow them whole without crushing or chewing to avoid the risk of increased side effects. If taking a liquid product, use a medication measuring device to carefully measure the dose and avoid using a household spoon. Some liquid products may need to be shaken before each dose, and products containing vitamin B12 may need to be placed under the tongue and held there before swallowing. Following the label directions carefully is essential for getting the most benefit from the medication. It's important to take this medication regularly at the same time each day in order to get the most benefit from it. It is normal to experience mild upset stomach or flushing when taking Folika-Bc 1 mg, 60 mg, 300 mg tablet multivitamins. These effects are usually temporary and may go away as your body gets used to the product. If these effects persist or worsen, it is important to seek advice from your doctor or pharmacist. If your doctor has prescribed this medication for you, it is because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience any serious side effects. While it is rare, a very serious allergic reaction to this drug could occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned here, it is important to consult your doctor or pharmacist. In the US, you can contact your doctor for medical advice about side effects or report them to the FDA. In Canada, you can also contact your doctor for medical advice about side effects or report them to Health Canada. Before taking Folika-Bc 1 mg, 60 mg, 300 mg tablet multivitamins, make sure to talk to your doctor or pharmacist if you have any allergies or health conditions such as diabetes, liver problems, or vitamin B12 deficiency. If you have phenylketonuria, PKU, or need to restrict your intake of aspartame, consult your doctor before using the chewable tablets or liquid products. Also, if you have diabetes, alcohol dependence, or liver disease, be cautious with the liquid forms of this product that may contain sugar and/or alcohol. It's important to inform your doctor about all the products you are using before undergoing surgery. If you are pregnant or breastfeeding, consult your doctor before using this medication to ensure safety for you and your baby. Pregnant women can benefit from maintaining adequate amounts of folic acid, which can help prevent certain spinal cord birth defects. Always follow the directions provided by your doctor or pharmacist. When taking Folika-Bc 1 mg, 60 mg, 300 mg tablet multivitamins, it's important to be aware of potential interactions with other medications. Some products that may interact with this drug include altretamine, cisplatin, certain antibiotics, certain anti-seizure drugs, levodopa, and other vitamin/nutritional supplements. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential risks or complications. Additionally, this product may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this product to avoid any false test results. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek emergency help by calling 911. Otherwise, you can contact a poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, residents can reach out to their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to seek help immediately if you suspect an overdose. Be sure to keep all of your scheduled medical appointments and laboratory visits. It's important to note that this medication is not a replacement for a balanced diet. It's always best to get your essential vitamins from nutritious foods. B vitamins can be naturally found in leafy greens, vegetables, meat, fish, poultry, and fortified breads and cereals. If you are using this product regularly and forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose as scheduled. Don't take double the dose to make up for the missed one. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed. Properly dispose of this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.